Hi there, this is Damian David with Healthcare Triangle. Welcome back to Week in Review. It's week number 27. Thanks for getting back to us. Been off a couple weeks just with some things that have been going on, some changes here at the company, changes in personal lives, etc. So back in action, fascinating week. Going to do the 3 different segments for you again. Headlines in the world of coronavirus, COVID-19, and then healthcare in general around the world. Secondly, going to have a fascinating interview with Melissa Hall, the Deputy CIO of Calvert Health. I get an opportunity to work with her quite often through some of the projects that we're both participating in, and it's fascinating. So, I kind of hear and privy to what she's doing outside of the hospital space as well, and she's participating in Moderna's clinical trial. So check out that little video call that we have for you this week, and she'll tell you all about how that clinical trial is going and what it's like to be a participant in that research. And then lastly, I'm going to leave you with some music like I always do and some visions around the election this year and COVID-19. So the interplay with those two things, some visions in that regard. I didn't get a chance to record anything new, just as a disclaimer. So instead, I'm throwing in one of the songs I did in the April timeframe before it made its way into Week in Review. So a flashback for me, music for you at the end of this episode. But yeah, something I did quite a while ago. Here we go. Let's get into it. Monday, November 16th, 2020. Vaccines. So we've been talking to you about vaccines this whole time throughout the coronavirus and COVID-19 experience. I've been trying to keep you up to date with some of the most current information. Well, this week currently we had 2 announcements from pharmaceutical companies that are well on their way in finding effective solutions for this COVID-19 thing. The first one being Pfizer announced that they had a 90% effective vaccine that was ready to go. It's phase 3 of the clinical trials. Fantastic. And then today we had an even more impressive one. Moderna came out with a 95%, 94 point something, rounds up to 95% effective solution for COVID-19. Dr. Fauci actually got on a program this morning and had mentioned that, hey, he expects by the end of December, at least these 2 offerings for Pfizer and Moderna will be available for especially the higher risk population that are suffering from COVID-19 to get them through it. They seem to be fairly effective as going through from the findings, and he doesn't seem to think that there's any sticky points in getting them through the process to be able to get them approved for use in treating COVID-19 throughout the regular general population. So obviously we have to start with a small focus just because we won't have a lot available to us at the beginning, but he expects at least those 2 industry-leading pharmaceutical companies to have their solutions ready to go, and he actually suspects that there'll be a handful of other ones as well, because it's kind of everybody's working on it, and there'll probably be multiple different options for us by the end of December. So keep your eyes on that. More on that, there's a link to Dr. Fauci's interview this morning in the description in the notes of this Week in Review, so have it that. Next headline, Healthcare Dive. They did a piece where they interviewed some influential hospital leaders. It mentions some of them that they talked to in the article. I left a link to that in the description as well. But what they discovered was that there's 5 overlaying common general thoughts and ideas that the leadership throughout the healthcare space want Biden to tackle and within his first 100 days of office should the votes be calculated and such that he becomes the next president. So what they're thinking is of the top 5, they'd like to see him handle and manage better. Let's get into it. The pandemic response in general. So how we're doing with responding to the pandemic, offering support, etc. throughout the country. Secondly, healthcare coverage in the questionable economy that we're dealing with. So those who might have lost jobs or are on furlough, how are they going to get the healthcare treatment and get coverage for that? How are hospitals and healthcare workers going to continue to get paid for that? So he's going to have to handle and manage that. Increased access to Medicaid, reimbursement in the transition to value-based care, making sure that we put into play some of the legal language and some of the whatever it takes to make telehealth a permanent fixture of healthcare. They see the benefits. We've been really doing a good job with telehealth based on the emergent response, the need to do it for COVID-19 pandemic. They would like to make sure that it's not just a temporary thing, temporary guidelines in place, but that they'll be able to practice that from some time into the future as an effective manner of healthcare. All right, headline number 3, Washington State in the news this week early. Governor Inslee orders new restrictions on indoor gatherings, restaurants, bars, and even gyms. So COVID-19, it's rising again. They're starting to get another surge in Washington State. Just as an example, Seattle itself, they're doing the numbers in the math. So 20% of the whole COVID-19 cases that Seattle has had over the course of the past, I don't know, where are we going on, 10, 11 months here? 20% of those have happened just in the past 2 weeks. So that's obviously a surge that's coming into effect. The governor is taking some precautionary measures, locking everything down, as I mentioned before. Schools and courtrooms, they're still operating as normal, but everything else seems to have gone into some sort of policies and procedures to limit the spread of COVID-19. So more on that to come. I suspect that other than Washington, other states will start to do this as well. I did watch, I'm in Lincoln, Nebraska right now. Our governor was on just a few moments ago, kind of outlining what he suspects will be common practice for us to mitigate some of the surge that we're experiencing in COVID-19 and the pandemic as well. So I think it's going to have a trickle out effect. Other states are going to probably take pretty drastic measures in the next coming months, especially as it gets cold outside and people have to come inside. It's really those close encounter, lack of movement of the air and filtration of the air, seemingly to increase the surge in the rise of COVID-19 cases. So just through weather alone and climate, we're going to experience a little bit of hardship potentially if we don't get it under wraps and under control. Okay, headline number 4. This week we had a HIMSS New England Chapter had its annual conference, and they invited other conferences or other regional HIMSS groups to participate in that as well. So collaborators were Alabama, Mississippi, and Southern California chapters. I dove in there real quickly, and I got some word back from the folks at Healthcare Triangle that participated with this HIMSS regional event. It was amazing. So I'm flashing through screen caps here in the video here just to give you an idea of what it was like to experience it. They did a really great job. I was super impressed. It's almost as if you were kind of in a virtual real conference, as if you were there. Like the rooms look similar, even the booths look like booths that you would go on a trade show floor, and then you could chat with somebody through the use of online tools. So I thought it was a really effective way to handle conferences, and I kind of look forward to maybe having these as an option moving forward instead of having everybody have to travel everywhere all the time for conferences. So it was a great share of information. Some of the keynote included Jennifer Sullivan, Brigadier General Jack Hammond, Jeanette Ives Erickson, Michael Allard, and Giles Boland. Our own Ryan Sommers and Alex Atkinson also did a presentation in session called From Burnout to Engagement about the physician and the provider experience in dealing with EHRs throughout the healthcare organizations. Really nice session. It's recorded, so if you wanted to revisit that, that's phenomenal. Next headline is we have a disaster recovery case for Healthcare Triangle. Successful spotlight case study for a community hospital in Iowa that wanted to go ahead and rest a little bit easier at night, knowing that if they had a ransomware attack or, heaven forbid, some sort of unknown, unexpected disaster that set their systems down, that they'd be able to not just recover, but they also have a plan of moving forward so that way they could service the community, especially in this time where, timing is critical, right? You don't want any downtime, especially in the pandemic era, for being able to treat and provide care for your communities here. So they looked to team up with us to get them to the public cloud. So their solution includes a disaster recovery availability solution for them, be able to access their EHR and operate as if nothing was any different for them and their end users through Amazon Web Services. So AWS was the cloud of choice for them. We helped them attain that opportunity, and so the case study is available in the description in the notes via link as well, so if you want to find out more about that. Also, I'm pretty up to date and involved with that project, so if you wanted to talk about it, please reach out to me. Would love to tell you more about it. So other than that, today is the last day you can register for AcmeWare's training DR201, which is the intermediate T-SQL or TSQL course. If you're Moving to Expanse, you've been in Expanse from the Meditech world. You want to understand how the SQL components of the data repository work, or BCA, or any of the reporting tools, the availability extracting and getting better at mining the data that you're capturing in an EHR. It's a great session to send some of your folks to. Again, last day to register for that is today. I think it locks up at about midnight. So the link is down below in the description in the notes. That brings us to the stats this week for COVID-19. So getting into the world confirmed cases, we're up to 54.4 million confirmed COVID-19 cases, up from 35.2 million cases from a few weeks ago, the last time we did a week in review. Quite a jump there just in 2 weeks. Recovered, we're up to 35 million from 24.5 million, and we'll hope to see that trend drastically upward as we hear from Pfizer and Moderna, maybe some of the other pharmaceutical companies, as they have solutions and vaccines for the COVID-19. And then lastly, we're up to 1.32 million deaths around the world from COVID-19, up from 1.04 million a few weeks ago, last time we did this. And diving into and zeroing in just in the U.S., we have 11.1 million confirmed cases within the U.S. borders for COVID-19, up from 7.44 million cases a few weeks ago. This country, we're not able to track the recovered rate, so we'll jump right to the death statistics, which is we're up to 246,000 deaths in the U.S. from COVID-19, up from 210,000 deaths a few weeks ago. Let's jump now to a conversation I had with Melissa Hall, the Deputy CIO from Calvert Health. When she's not working and she's not making sure that they're up to date and everything's working and flowing well throughout their IT and IS at Calvert Health, and when she's not taking care of her dogs as well, she actually is participating in one of Moderna's clinical trials. They're into phase 3. We heard about it this morning. Let's hear a little bit more intimate details on what it's like to be a participant in that research study with Melissa Hall. We'll transition now. Good morning, Melissa. Good to see you. How are you doing?
Good morning, Damien. How are you?
I'm doing well, thanks. Hey, so you kind of mentioned to me a while ago now that you were going to participate in a research study around a vaccine around coronavirus. Real interested now, some time has passed. Are you able to tell us more about it?
Yeah, sure. And yes, I am in it. I'm actually in the Moderna mRNA, which is a messenger RNA study. So it's double blind. They were looking for 30,000 participants across the United States, and I think they hit that number. But a messenger RNA vaccine is that they don't actually inoculate you with any part of coronavirus or whatever virus they're trying to protect you against. Instead, this messenger RNA is injected, and the idea is that you make proteins that will protect you against whatever virus attacks you. You build antibodies to it. What happens is it's a double-blind study, so I don't know if I actually got the vaccine or if I got saline. At first, I was adamant that I got saline. I didn't feel like I had any reaction at all to it. I mean, I had a sore arm, and actually my arm was sore with that than it was with the flu vaccine. And so the doctor, there's a ton of people that are working for University of Maryland to do this research. And the doctor that checks you out when you go in, he actually said that, you might have gotten it. He said, because, that's usually what people complain about is muscle soreness. Other people have way more reactions, but it's a double vaccine. So I had to go 1 month, and then 28 days later, I had to go for another shot. And actually the second shot, I actually had joint stiffness and soreness, and it actually was almost within about 4 hours of getting the vaccine that I had the reaction to it. So I still don't know what I got, and I probably won't know for another 18 months. It's a 25-month study, which is a long time to be in a study in my mind, but it seems to be worth it, and it seems to be, it's not a lot of work on my part. Instead, they pretty much just bring you in every few months to have blood work done, and they take probably about 8 to 10 vials to make sure that you're building antibodies. I have been tested for COVID now twice due to this study, And they don't tell you to go out and get exposed to it, but they do say, if you're out there, go out and do it. Yeah, so it's been kind of interesting. I can say that there's a lot of healthcare people in this study with me, at least at the University of Maryland. It's a part of the University of Maryland Medical School. So there's a lot of providers that I've actually met through the study.
So for 22 months, you're going to continue do you have to go into University of Maryland, or how far is that trek? How long does it take you? And is it a weekly thing, or what's it look like?
Oh, I wouldn't have done it if it was that. Yeah, so I drive an hour. They kept me there for about 6 hours that first day, which was really, really long. And there was a lot of downtime where you're just sitting there waiting. And then a month later, I went back and I got the second shot, and they did this almost the same thing again, but a little bit reduced. So I was only there about 3 hours that time. And then I just went back the middle of October, so another month after the second injection, and all they did was lab work, and I was there for probably about an hour. And now I don't go back until March, but they do weekly calls, a certain number of weekly calls where they check in with you to make sure you don't have any symptoms. Yeah, so then they have this app they make you answer questions for, and it automatically pops up when it wants you to do things. And so in the beginning, it made you take your temperature. You had to answer a bunch of questions about whether or not you were having a reaction to the vaccine, or whether you were experiencing any COVID-19 symptoms. And then now it's been once a week, this app pops up and asks me a question if I've had any new symptoms or anything, and then it goes away, and then it comes back again. And then I have another call with them coming up where they just check in with me. Now, the interesting thing about this study is that if I become sick, like I may have COVID-19, I don't actually go to the emergency room. I call them, and they actually send somebody to my house. And I told them, I said, are you sure you're going to send somebody to my house? Because I don't live near University of Maryland. I live, an hour south of it. And they said, nope, we'll send somebody to your house, and they'll do the testing and everything. So, and they did say that in an emergency, if you needed to know whether or not you got the saline or you got the vaccine, they can find out for you and tell you. The other interesting thing is that now that the vaccines are closer to being released, we may get one sometime this year. If hospitals require it, and what do I do? Do I take that vaccine? Do I stay where I am? What will my organization let me do? The good news is, for me at least, I'm not in the high risk. I'm not a first responder. I work in administration. I'm off-site. I don't actually interact with patients anymore. And so I'm hoping that I can keep myself out of the whole situation and not have to worry about bringing forth to the organization that I've had the vaccine, and don't try to force me to take it.
Yeah.
And when I asked the study people about it, they said that Moderna has not come forward with what they're going to do yet. And I said, well, if Moderna wins, I don't have to worry about it. I mean, I can kind of just say, oh, I got it, maybe. And, I have this paper, so I don't know what's going to happen. But I know that I'll be later in the requirements of people who have to get it. So that I think I'm going to be okay for a while. I've tried to keep ourselves a little bit safe, but I've also been the one to go out and do more things because I've got to see if this vaccine actually is a vaccine.
Yeah, I see what you're saying. But it's interesting though, because it's the RNA principle, right? So it's not like it's not a typical vaccine where they're trying to give you a portion of the actual virus. It's really just the proteins around it that they think will neutralize the virus, right?
Right. Yeah. And it's whether or not you're making those antibodies, and in their studies, according to the phase 1 and phase 2, everyone made antibodies that got the vaccine. So they actually went to phase 3 before phase 2 was over because of that.
Oh.
But you know, there are a lot of people that complain that they had a lot of symptoms from the actual injection. But the funny thing is that I got the flu shot 2 weeks after I got the second Moderna shot. So I got the Moderna in my left arm and I got the flu in my right. And the flu shot actually did not hurt at all this year. I didn't have soreness. I didn't have anything. So I was like, okay, maybe the mRNA neutralized the flu and didn't actually cause me to have arm stiffness. So it's the first year I think in a long time I haven't had arm stiffness from the flu shot.
Yeah,
but
I know.
I had plenty of stiffness from the mRNA. So
yeah, I get the stiffness too because I get hit up every year as well. So
yeah.
I think most professionals in the industry are almost required to. So
yeah, definitely.
Well, that's fascinating. Thanks for sharing that with me. I was intrigued when you were talking about it. I know you were a little bit excited to see what would happen. I was definitely excited to hear more about it. So thanks for taking a couple of minutes there and spelling it out. I'm excited to hear. 22 months is a long time, but I'm excited to hear the outcome. And I'm hoping. I'm especially interested in this type of methodology where you don't actually have to get a portion of the virus itself. I think that fascinates me, and I hope we can prove that type of method because I think just in vaccines in general makes it quite a bit safer. So
definitely.
Yeah, that's exciting. All right, so I usually put people on the hot seat with a hot seat question. Are you ready for it?
I'm ready. Let's go.
All right, here we go. So obviously in this world of coronavirus pandemic, we've been doing this for about 11 months now. We're no stranger to some of the trials, the challenges, some of the bad things that have come along with COVID-19 and the experience. On the surprising flip side, some people have actually started to do things because they felt that they've had to throughout this experience that they might be better for. It's the positive side of COVID-19 and coronavirus. Like example for me, like I'm doing these on a weekly basis. At the end of it, I always do the lunch break coffee house. So it's brought that back into my life. There's some happiness in there amidst all of this other craziness in the coronavirus world. Is there something that you can think of that you have been positively influenced by this whole effect that you think has been for the better in spite of all the challenges and trials that we've been facing?
I don't have anything that good, to be honest, but I do have to say that, I moved out here from Northern California 6.5 years ago. And even though I had grown up on the East Coast, Maryland was a culture shock, even for me. And I grew up in rural Virginia, so you would think this would not be, but it is. It's an interesting place here. It's different, especially Southern Maryland. It's its own little culture area. But I would have to say that, the coronavirus and the fallout from it of having to, pull ourselves back in and not be able to have that regular lifestyle that we had gotten used to where, we're out and we're about and we're able to go anywhere we want to go. That one thing that it has really impacted my life of the fact that I've actually had to do more with the people that I wouldn't do things with here. Does that make sense? So
yeah, so you've experienced people.
Yeah, I still have my California friends and they come out here. And before COVID-19, they were my friends. I didn't really have a lot of friends here. I didn't really interact with a lot of people just because I have a different lifestyle than they have. Not in a bad way. We all had different interests. And for those who are watching this, I have Great Danes. Everybody else has kids. So, there's a little difference here. And it actually has forced me to make friends with people here, or not even make friends, like the people that I enjoyed working with. But now I actually have had to do more with them because we're all kind of in this little zone and we are kind of staying in our own little circle of protection, and you can trust that they are also keeping themselves protected,
Yeah.
and that way you may be doing a little bit of risk, but you're not doing a really high risk, and so you feel like you're safer. And so I think that it has forced me and some of these people that have become my closer friends now, they forced us to change the way we approach our friendships with people. I've only gone to see my brother and my sister-in-law and my nephews once since coronavirus has started. So, we're really not doing a lot because of what's at my house and trying to keep everyone safe. And I have to say that, do I see this continuing post, whenever we get the vaccine and everybody is feeling a little more safer and protected? I think that these friendships will. So if nothing else, it's made me, after 6.5 years, realize I had to change my approach to how I develop relationships outside of work, I guess. And like I said, nothing like a blog or making music, or I'm not doing any of that, but it's just not my thing. But it's definitely been an interesting time, and I'm watching other people go through the same growth that I'm going through, and it's very interesting to me, and that's probably way more therapeutic than you ever wanted to hear. But anyways,
I don't know. That's a beautiful thing. It's as cool as you think mine sounds like. Mine doesn't cause me to tear up when I hear about it. So I think yours is actually. I appreciate yours. That's fantastic. The connecting deeper just through the experience. It's an amazing thing to hear about. So I like yours better.
I don't know about that, but it's different. It's just different. So, like I said, I don't have anything else. I'm not doing anything else, except I got a puppy, but that had nothing to do with coronavirus. That's just where I was in my life. But this has really impacted everyone, and it's definitely draining. It's getting old, and I have to keep reminding everyone that as Americans, we're not used to having these restrictions put on us, and the longer it goes, the more we start to rebel against it. But we can't let it push us, over the edge. We've got to figure out how to keep ourselves, centered. And I've really tried to get my staff to realize that too, because social distancing is a drain, and it requires a lot of work, let's be honest. And I understand what everybody's going through, and I know it's hard, but we're getting there. We just gotta hold on, and,
I agree. More important now than ever.
Yeah, definitely. My thing keeps going to screensaver because I keep forgetting to move my mouse.
Hey, your security tactics are working, so that's great.
They are working.
That.
They are. They are doing their job beautifully today, more than any other day, I think. But anyway.
Well, great. Hey, Melissa, it's always great to talk to you. Thanks so much for doing this with me. It means a lot to me, and hopefully it means a lot to people that are watching this too. So again, thank you, and stay safe. I'm looking forward to getting out there at some point when you guys are starting to have people on campus, and I don't know, doing something simple like grabbing lunch or something.
Definitely. Well, thanks for having me.
Absolutely. All right, take care. I'll talk to you soon.
All right, have a good day.
Well, hey, what a great interview. Thanks, Melissa, again for doing that with me. As you could tell, we did that a couple days ago, back before I had my haircut. I no longer have the crazy corona hair. I decided to actually re-enter the world of hygiene. I don't know what you call it. Anyway, so this is my new COVID cut. I hope you guys like it. Anyway, again, thanks to Melissa Hall. Fascinating. I just can't wait to hear all about it once this research is wound down. So hopefully we can circle back with you over the next 12, 22 months as you get through the whole research project. But thanks again also for participating. I think it's very courageous of you, and I think it's helpful to our communities. With that said, I'm going to transition now to some music and some visions around 2020, COVID-19, and the presidential election cycle. Be safe. Again, keep up the energy. Please wear your mask. Let's be there for each other, and I'll see you next week. Take care.
So